To RCI's Boost Your Business webinar series. Today will be our second webinar that will cover, are you ready to return to work safely? Our guest speaker will be Mrs. Holly Douglas, Vice President of Cosmos Technologies and OSHA Outreach Construction Safety Training. You may be familiar with Holly from our OSHA trainings with BizFit. Today, she will dive deeply into the details of being safe at work and being prepared and ready for work. And with no further delay, I would like to introduce Holly, but also make a note that tomorrow at 10 a.m., we will host a Prepare for Now reopening of the PPP, which is SBA's Paycheck Protection Program.
So Holly, take it away.
Holly, take it away.
Okay, all right. So it is really good to see that. I know a lot of people that are on this call. So truly, thank you for coming back and spending the afternoon with me. As James said, my name is Holly Douglas, and I am with Cosmos Technologies. Because my boss is in the room, let me just tell you a little bit about Cosmos. We are a civil engineering firm. We have offices here in Pittsburgh, as well as Harrisburg, Pennsylvania, and in Akron and Cleveland, Ohio. In addition to engineering, we also have a environmental health and safety department, which I'll talk to you about a little bit later. But as we get started on this, how to return to work safely, I just want to, for those of you who do not know me, just give you a little bit of background in terms of why I am the presenter for the day or presenter for the afternoon. So once upon a time, I was an environmental engineer working for an oil and gas company, and I had the opportunity to transition to an environmental and safety engineering position. And so I thought, well, how hard could safety be, right? Long story short, what I found out is that you flip a coin and you had better than 50% chance that you were not going home the same way you came to work. And so from the first day with a paraplegic to a couple months later with, 2 deaths, I actually became all things OSHA, right? I, deep dived into OSHA. I met with them regularly, even when they were coming to inspect us. I was asking questions and just really trying to learn. I ultimately went back for a graduate degree in safety. And since that time, the good part of that story is that the last 7 years that I was with the company, actually we turned it around within 2 years, but the last 7 years that I was with the company, we had no lost time injuries or illnesses. And in fact, we had several years where we had no incidents at all. So that was the good story. I left there and went to manufacturing, industrial, and certainly in consulting now. And so over these past 20 years, I've had and helped a lot of companies in terms of developing safety programs and policies and conversations around safety, and certainly have helped develop catastrophic response plans and recovery plans. And so while I have not done a COVID recovery plan, because this is new, I think we can all agree that this is a catastrophe that we are going to recover from. And so certainly I'm hopeful that the information that I give to you today will help you do just that. So let's talk about how to return to work safely. And I just realized I have not shared my screen. So, all right, so can you see my screen?
Yes.
All right, so let's talk about what we're going to cover today. I just want to start with what is COVID, right? I think we need to, basically define what it is that we are talking about. And then I'll cover risk identification. So OSHA has identified 4 different risk levels. And so we'll talk about where your company fits in with regard to risk and what that means with regard to what kind of preparedness do you need to do to bring your workers back. We'll talk about how to, just practical lessons about how to prepare your workspace. And then we'll talk about safety procedures. I think one of the questions that came in before the program actually began was, Are you going to give us some examples of safety procedures that we can put in place? And we'll certainly talk about that. We'll talk about personal protective equipment kind of lightly, but I do want to deep dive into respiratory protection for obvious reasons. And then I want to talk about record keeping. Some of the questions that people are constantly asking me now is, oh my God, COVID-19 is could be a recordable illness. What does that mean to our company? And so here is my disclaimer, and I'll say it a couple times during my presentation. I am not an HR person. I don't want to misrepresent. And so when it is specifically an HR situation, I will refer you to those experts. But certainly, hopefully, I'll give you some questions to ask so that you can have a more valid conversation and incorporate that into the recommendations that I am giving you. All right, so what is COVID, right? So COVID is basically known as coronavirus or COVID-19. It is a SARS disease, SARS meaning a severe acute respiratory syndrome. So SARS-CoV-2 is another name for it, but basically COVID-19. It is a respiratory disease that we are now seeing in over 150 countries. And the symptoms can range from either mild to deadly. So we've got a severe range there, right? But basically the symptoms for COVID-19 are a fever, cough, shortness of breath, and the symptoms can appear as early as 2 days after exposure to 14 days after exposure. And so all of the recommendations now are that there is at least a 14-day incubation period. So be mindful of that. The recommendations or the conversation now is that the virus is spread person to person within a 6-foot distance through respiratory droplets, whether in sneezes or coughs, and/or by touching objects with the virus and then touching your T-zone. So your facial T-zone, anything from your eyes, your nose to your mouth, right? Recognizing that is the way that the virus can be spread. So when I said that, I started into all things OSHA, I think the first and foremost thing that we as employers need to think about is that when we are bringing our workers back to work or even the workers that are at work, it is our responsibility, according to the General Duty Clause in OSHA, Section 5A1, is that we will provide an employment and a place of employment that is free from recognized hazards, right? And so I have always spent a lot of time talking about conversation, but before I go there, let me just make sure that you understand that you need to look at where your potential workplace hazards are and then come up with a feasible method to correct or minimize that hazard, right? And so we will spend a lot of time talking about what you can do with regard to face masks or social distancing or whatever practices you put in place. But the one thing I want to emphasize is that this COVID-19 is an illness. And you absolutely must have good conversation with your employees, right? I always tell folks that I train that, when we talk about free from recognized hazards, sometimes we as employers will not recognize the hazard, right? We may give them a car that we've inspected, but then maybe a day later, the brakes are a little bit squishy. We wouldn't know that, right? The car was inspected. Everything was fine when we gave it to you. So we really need employees to feed back that they have identified a hazard so then we can then go get the brakes fixed, right? In this case, this is an illness. And so somebody may come to work or not come to work and say that they are ill. We have got to get from then clearance to be able to report back to the rest of the workplace team if they indeed have been at work and go home and then test positive for COVID. Otherwise, we cannot have that conversation with the rest of the workforce. That is a HIPAA issue. And so here is my first disclaimer. This is something you're going to need to talk to your human resources people about if somebody in your workplace then tests positive for COVID, what kind of information can you give to the rest of the people? So I'm not on that part of it. I am, let's prevent people from getting COVID in the first place. But be aware that that conversation that then happens after is really something that you need to get some legal advice because you don't want to violate somebody's HIPAA protections. All right, so any questions so far? All right, so before we get into the different risk levels, I just want to go over the hierarchy of controls, right? OSHA says that the last thing that an employer can do is put their person in personal protective equipment. That is the last level of control because they want to see that you have removed the hazard to the extent possible before you're actually protecting somebody against it. So the hierarchy of controls starts with elimination, goes all the way down to personal protective equipment. I'm going to start our conversation with engineering and go from engineering to administrative to personal protection. I mean, obviously, we can't eliminate COVID-19. If I could eliminate it, I'd be rich, right? Can't eliminate it. We can't substitute it. We're like, nah, we don't really want COVID-19. Let's go back to the flu. We like the flu. We can't do that either. So we're going to start with engineering controls, meaning what are you doing to engineer out the situation? Administrative, I tell people that's more like an HR thing. So that's more like the social distancing. So engineering would be like ventilation controls or things like that. Administrative might be the social distancing or certain work practices. And then ultimately the personal protective equipment, like I said, we'll talk about maybe hand protection, eye protection, you know, masks, respirators, okay? Okay, so OSHA basically has identified 4 different risk levels for your employees. The lowest one being caution, a low risk, medium, and then I'm going to talk about high and very high together. Okay, so the first level, low risk or caution, is if your employees have a minimal occupational contact with the public and or other coworkers. So maybe let me use my office as an example. There's not very many people that actually work in the office, and people that come in might be repair people for the copier, or delivery people, Federal Express is delivering mail or whatever, right? So basically the people in that office situation have minimal occupational contact with the public or other coworkers. Same thing for like long distance drivers or people that, you know, typically work by themselves, maybe go into an office here and there. That would be considered low risk. And so for the engineering controls, it's really not applicable. There's really nothing that OSHA is requiring that you do. If you do have engineering controls as part of other job responsibilities or other job hazards, you obviously need to keep those in place. So I've put the muffler on the car, or, you know, I have, you know, a barricade or whatever. That engineering control for that situation needs to be in effect. But with regard to COVID-19, there's nothing that is required. For administrative, it's important to communicate COVID information. There's a lot of things coming out, whether it is the CDC recommendations or public health recommendations, you know, even the county briefings and things like that. Making sure that you communicate and share that information with your employees as to, you know, social distancing requirements or mask requirements or what have you. And then ultimately PPE, personal protective equipment. Again, that's not applicable, but you want to continue to use it if you are using it for other job hazards. So, you know, we require that our employees wear respirators for certain job tasks. That would continue. or gloves for a certain job task, that would continue. Let me just kind of pause for, well, I'll cover it under personal protective equipment. All
And
right,
real,
I'm sorry.
real quick, Holly, I was going to add, we will take questions from the chat. So when you pause, we'll make sure they type them into the chat and we'll try to do a Q&A in between.
Oh, okay, okay. So I will pause between certain sections to, you know, not get too far ahead.
Sounds good.
So for medium risk, those are people that have frequent or close contact within 6 feet of each other. So those are more for the dense work environment. So maybe you have a space, maybe there's not a lot of people in your space, but your space is very tight, or a supermarket or a barber shop, or, you know, you're constantly, as a requirement for your job, you just need to be around people. That is considered a medium risk. And so to the extent that you can, you want to start looking at engineering controls. So maybe you look at physical barriers, right? The example given here are sneeze guards. So maybe plexiglass or plastic between your conversation and another person's conversation. Administrative, you want to minimize the face-to-face contact. Maybe you want to spread your people out. Look at ways to maybe not be in the workspace at the same time. So maybe you're looking at, you know, different flex work schedules. And then you're looking at PPE ensemble. So you're a construction site. You're working around a lot of people. And so what kind of personal protective equipment are you wearing? Are you wearing the mask? Are you wearing gloves? You know, what is it that you could, or how could you be exposed to COVID-19? And then what are you doing to protect against that? Because now you've got an environment that you are not necessarily in control of. And then, like I said, I wanted to share high risk and very high risk together. These are really people that are in contact with definite, defined COVID positive people. So your medical, your postmortem, your laboratory. And obviously we're going the full gamut. We've got the engineering controls like the air handling systems. We've got the administrative controls, enhanced medical monitoring. We're doing signage. We're doing social distancing to the extent that we can. I put up in here stress support. And you may want to consider this even for medium risk as well. People are very concerned about the potential for exposure and taking that exposure maybe back to their homes. And so, you know, maybe looking at stress support. Obviously, it's very important under high risk and very high risk that you're offering some sort of stress support or EAP program or even conversation. And then personal protective equipment, certainly the gloves, the gown, the face mask, goggles, you know, respirators, all of those things come into play. So those are basically the risk levels. But before I stop for questions, I just want to kind of go over basic infection prevention that covers kind of the full gamut. Because right now we're like, okay, I want to go back to work. What do I need to do? Right? You told me about the risk levels, but I need more. I got you. So one, you want to encourage people to stay home if they are sick, right? And you want to, and here's another time when you want to talk to your HR person because you want to have some flexibility for your workers, right? You know, we're intentional or not, sometimes, you know, businesses have been like, oh, we got to get this project out the door. And so, you know, people feel compelled, well, I'm not really feeling 100%, but I better get in there and get this project out the door. This is a different kind of conversation. This is a different kind of scenario. And so you want to look at what is your policy to allow people to stay home if they are sick, and stay home if they are caring for somebody that is sick. And then what is going to be your policy and procedure for returning them into the workplace? We'll talk about that a little bit later, but basically the first and foremost conversation that you need to have with your employees is if they are sick, they need to go home. And if they are sick and they have the option to not even come into the office, to stay home. The next is you want to encourage frequent hand washing. So, you know, there are a multitude of videos now about how to wash your hands, whether, you know, you realize you needed it or not. But the recommendation is to wash your hands with hot soapy water for at least 20 seconds. Now, for construction sites, right? So it's not like I can say, there is, of course I would cough, right? It's not like there is going to be a place where they can wash their hands in the middle of the street. And so in that case, maybe what to do is make sure that you are providing alcohol-based hand wipes. And they recommend at least 60% alcohol. I recommend 70% because there's quite a little bit of discrepancy. But you want to make sure that there are hand wipes for your employees to use in the field. You want to teach and practice respiratory etiquette, right? So we know that if you have to cough, you want to cough into your elbow, not into your hand like I just did, but you want to cough into your elbow, you want to sneeze into your elbow. If you are sneezing into a Kleenex, you want to make sure that you are providing receptacles near the Kleenex so there's no contact, you know, so nobody comes in contact with those contaminated materials. And then you want to encourage people that do that to wash their hands before they would touch or be around anyone else. Some safe work practices, maybe if you can telecommute, you continue to do so, right? If it's working for you, maybe, you know, if you have to come into the office, maybe you develop flexible work hours. So, you know, maybe half of the workforce comes in at a certain time and the other, you know, comes in at a different time or on different days. But look at those kind of safe work practices to encourage social distancing. You want to limit the amount of access that people have to your workspace. So Juan had shared some recommendations in terms of, you know, maybe leaving the door to your office open so people don't have to touch the doorknob every time they want to come into your office. But certainly maybe stopping people at a certain area in your office before they would come into the entire workspace area. With certain, you know, requirements. Here's a face mask, or, you know, here's gloves. You know, if you enter, you need to, you know, have this material on you. Or, you know, we're only allowing 2 people or 3 people into our workspace at any one time. If you have the flexibility, maybe you're a painter or something and you're painting the interior of a home, you know, we need to block off this area. And only our workers can access this area until we're done painting, as an example. For barbershops, maybe staggering your appointments so you're not having people sitting in that space waiting to be served, but are actually coming at specific designated times. You want to discourage shared resources. So in an office situation, that's your desk. I'm not going to sit at your desk. I'm not going to answer your phone. That is yours, and you are in control of it. If you're on a construction site, these are your tools. This is your iPad. You are in control of it. If you are going to have to share resources, maybe there's a copier that everybody's using. Maybe in order to use the copier, you need to have on gloves. If anybody comes in to service the copier, they need to wear gloves. And then at the end of the day, we'll take our alcohol wipes and we'll wipe down, you know, our equipment and our materials. Certainly you want to maintain regular housekeeping practices. At the end of the day, all touchable surfaces will be cleaned down with XYZ cleaners. Now, on EPA's website, that would be www.epa.gov. You can Google it because it's a long reference. You can disinfectant use against SARS-CoV or disinfectants, I'm sure would come up as well. They talk about you can use bleach, hydrogen peroxide, or rubbing alcohol to clean for cleaning. They do not recommend vinegar. They say it's very ineffective. But basically for those do-it-yourselfers, if you're going to clean with bleach, it's basically 4 teaspoons for every 1 quart of water. And then if you are using bleach, you want to leave that, that solution on the surface for at least 5 minutes before wiping it off. If you're using the hydrogen peroxide, typically the hydrogen peroxide that you buy, over the counter is about 3%. They say that you can use that directly out of the bottle. And if you're wiping things off with hydrogen peroxide, again, you want to leave that solution on the surface for at least 1 minute. And then for rubbing alcohol, the recommendation is 70%. That's why I was saying I would recommend for cleaning in the field 70%. They say you can use 70% rubbing alcohol, and you can leave that solution on the surface for at least 30 seconds. And then, like I said, they're not recommending vinegar at all. And then you want to encourage your workers to report any health and safety concerns that they have, and any health and safety recommendations that they have. Maybe they're seeing something that you don't have. I am a big proponent on conversation, right? You just need to know, and nobody has all of the answers. So certainly you want to encourage that conversation and that ongoing conversation. So I will take a pause right here to see if anybody has any questions, and we'll talk about some safety procedures next.
Sure, Holly. So our first question is from Ryan Haggerty. He's asking, should we make sure workers have masks available in minimal contact scenarios? And does the state recommendation for people going out in the public to wear masks have any bearing on wearing masks in the workplace or while commuting to the workplace? So where we are with this return to work as an employer, we are only responsible for our workspace, right? And so for low risk, they are saying that that is not necessarily a requirement. Now, that might be something that you want to institute, and or what I'm recommending is, and we'll talk about when I get to the respiratory protection, is allow people to wear those things, right? If you can't social distance, if your people are within 6 feet of contact, then I would absolutely have the face mask, regardless about the risk levels, just because. Now, recognize that those face masks are really protecting other people. That's not necessarily protecting you. It's protecting other people from you. And so those face masks, one person would be protecting the other. So yeah, if you can't really social distance, I would recommend the mask. But as far as going to work or outside of work, that's not under your control or your responsibility. Did I answer your question? Yes, thank you for that, Holly. Our next question is from Olivia Minifield. Her question is, so her company is in the demolition field and have a garage where we work on equipment. In both areas, the employee numbers are low, but what are some of the scenarios we could put in place to keep our staff safe and healthy?
So I would absolutely recommend, particularly when you're looking at tools and things like that, those are going to be shared resources, right? And so at a minimum, I would have your people wearing gloves. If they're not, if they can social distance, I probably would not be as concerned with the face mask. And so I'm a little jaded with face masks. And so, certainly use your best judgment and do what you are comfortable with. I'm a little concerned because, I'm used to respirators, right? And so I know that, putting something over your face and your mouth is a little bit harder to breathe. And so, as quiet as it's kept, they're not really recommending that children put on these face masks because it is a little bit harder to breathe. And so, like I said, I'll leave that to your best judgment, but at a very minimum, because you're going to be sharing equipment, I would have you wearing gloves. And again, I would practice regular housekeeping with regard to shared surfaces.
That's all the questions we have for now. We can continue on into your presentation, Holly.
Okay. All right. So now I want to talk about the written safety procedures. We're going to talk about return to work policy, bloodborne pathogens. I get it. We'll talk about bloodborne pathogens. It's not necessarily related to this, but I think this is a great resource for people. We'll talk about hazard communication, personal protective equipment, and then we'll end with record keeping. All right, so with the return to work policy, again, this is kind of a human resources thing. You want to develop a policy and procedure for employee self-reporting. If you are sick, if you go home sick, if you test positive for coronavirus, what are the policies, what are the procedures? Because ultimately you need to think in advance, what happens when somebody tests positive for COVID? When are you ultimately going to let them come back to work? Is it when they say that they're feeling fine? You know, if they go out and they're having all of the symptoms, but they did not necessarily test positive, are you waiting for a certain period of time to pass for them to test again before they come back? All of those things you need to talk through perhaps with a human resources person to figure out what is the best policy and procedure for that. As well as maybe looking at, you know, do you need to develop any flexible policies for sick leave, for self-care or family care, right? I'm not saying that you have to pay for sick leave or any of that. That's, you know, that is a business decision. I'm just saying that maybe you want to have a policy in place that tells people what the expectation is. We expect that, you know, you can take, you know, leave without pay, your job is guaranteed up to a certain period of time, whatever. Again, that is a human resources, you know, discussion. But certainly the whole focus of a return to work policy is, when are you going to allow people to return to work? So as I kind of started off with, is that bloodborne pathogens, this is not a bloodborne disease. This is really exposure to body fluids or respiratory secretions. However, if anybody is looking for a really good exposure control plan, I would recommend looking at the bloodborne pathogens as a template for putting something together. You know, because basically it talks about identifying tasks and control procedures. It talks about hand washing and alternate facilities for cleaning. It talks about disposal of contaminated materials, in this case, maybe Kleenexes. And then, you know, how to work through decontamination. So I kind of like this particular program because there's a lot of templates out there, particularly on the OSHA website for free, where you can kind of use this to help you walk through what your particular work procedure, what your particular work policy will be. Now, there is a difference between a policy and a job hazardous analysis. And so overall, I've got a policy about what it is that I want people to do in the workplace, right? A job hazard analysis is really that specific requirement. When I am doing construction work, here are my associated hazards. You know, I may come in contact with people. I'm going to have to touch this. I'm going to have to lift this amount of weight. And then you have criteria as to how to minimize those hazards or what type of personal protective equipment to wear. So I'm talking a lot about policies and procedures, but I also want to make sure that you realize that you also probably need to, not probably, you also need to look at job hazard analysis for specific tasks in your workplace and where certain personal protective equipment or certain administrative controls or certain engineering controls actually come into play for those various tasks. The next policy that I want to talk about is your hazardous communication plan. I'm hoping that everyone has a HazCom plan. A lot of people, you know, don't necessarily see the value of it. But in this case, you are bringing hazardous chemicals into your workplace, right? Because you're going to start cleaning, you're going to start disinfecting. You want to make sure that you are retaining those safety data sheets that come with that material, and that you are looking at that in advance of its use, right? So the safety data sheet is going to give you a lot of good information about the product. So let me just share a quick little example. So I'm looking for some cleaning products for my guys to take into the field, right? So I was looking for a packet of cleaning wipes. This particular packet had a coconut base to it, was alcoholic, but it had like a coconut base. I'm very allergic to coconut. And so that immediately raised a red flag to me, right? I mean, I wouldn't have thought that there would be something that could cause harm. And so I need to make sure that as I'm getting materials, I'm sharing with my staff what is in that in case this is something that they're allergic to, right? In this case, I was allergic to it, so of course they can't have it. But you know, maybe it'll cause coughing or wheezing or an allergic reaction or asthma or skin burns. So you want to look at the safety data sheet to look at those ingredients just to make sure that you feel that they're safe for your entire population. You want to look at, you know, what is the particular use for that material, right? So are they recommending that, you know, how you use it, how you store it? Maybe when you use it, you have to dilute it. So you need to know that as well. And then what to do in the event that it spills or causes some other emergency. If somebody has an allergic reaction, what do you do? So you need to know those things in advance. You know, in this day and age now, right, we're big hoarders. We want to get everything in bulk because we don't know how long this COVID-19 is going to last. And so if you do order cleaning products, for example, in bulk, and you're going to be transferring those into other bottles, you want to make sure that you're using the appropriate labeling, right? And then ultimately you want to train your employees to know what it is that they need to do. Like, where are these sheets located? What do they say? How do I read them? We all know the little cartouche that has the skull and crossbones, right? We know that's probably not a good thing. But there's other pictograms that we may not be intimately familiar with. You need to make sure that if you are labeling using those pictograms on a label, you need to make sure that your employees understand what that picture means for them. And then the other thing that I just wanted, you know, to say is it'll also tell employees what they need to do. What kind of personal protective equipment do they need? And that, you know, regardless, after they use any of these cleaning products, they should be washing their hands. So one of the things that I did want to point out with regard to cleaning products, just as kind of an aside, is that everything that says green in the title is not a green product, right? Green products are certified as green products. They're not as harmful to the environment. And so if, you know, just because it says green clean does not mean that it's a green product. It has to be certified. And know that if you have something that is a green cleaning product, there is not an odor associated with it. So if it has an odor to it, it's probably not certified as a green product. Personal protective equipment. So as I said, when we talked about the different risk levels, that if you are using, let's just say hand protection, since I started with hand protection. If you're using hand protection for another concern, for another job hazard analysis, let's just say you're using Kevlar gloves, right? You're a baker and you're using Kevlar gloves. That is not going to be protective against COVID, right? And so maybe because you are using those type of gloves, you can't use gloves that are protective against COVID. So you're going to need to look at how can I continue to provide a safe work environment for my workers if it's kind of precluded from wearing the proper gloves, right? Kevlar is a little bit heavier and is more specific to what they need to protect them from work hazard analysis. So maybe I'm going to look at cleaning my work surfaces, or maybe I'm going to look at another type of protection in this situation. Eye and face protection. Again, you know, with this illness, with this disease, we're really concerned about things splashing into the T-zone, into our face and eyes. And so looking at, you know, how we can protect, you know, in a personal manner, that particular area. Now, face masks are not respirators, okay? But my recommendation is to treat them similar to respiratory protection. So let me move on to respiratory protection. For respiratory protection or respirator, if you are wearing a respirator, you have to get into a respiratory protection program. That means that you have to take a pulmonary function test to know that you have the capacity to breathe through a respirator. Now this, the governor has mandated that we wear face protection. And so no, you don't have to pulmonary function test your employees. What I do recommend, however, is that you have them sign off on the voluntary use part of the respiratory program, to make sure that they understand that's not a respirator, but, here's how you wear it safely, and here's the conditions where, they want to wear the face mask. But for the respiratory protection program, you need the pulmonary function test, and then you need to provide them with a respirator that fits to their face, and you need to teach them how to do fit testing. Now recognize that the face masks that we are wearing now are not tight, and so things can pass through it on the sides, as well as through it through the material into your breathing zone. It is really meant to stop large droplets. And then ultimately you need to train them about the respiratory protection program, how to clean their respirators, how to care for the respirators, when they wear them, when they don't, and then maintain those type of records. Let me move on, and then we'll ask questions at the end. The last thing and the more critical thing is that COVID-19 can be a recordable illness if the worker is infected as a result of performing their work-related duties. And so I know that this concerns a lot of people. However, there is a 3-pronged test for this that are listed on the screen. So first, the case has to be confirmed. I'm not going to go home and say, I've got COVID, right? They have to have a test that proves that they are COVID-19 positive first. 2, the case must be work-related. Now here's where we get into the job hazard analysis, right? I say, okay, my construction workers, you need to wear gloves, you need to wear face masks while you're at work. After you take off gloves, you must wash your hands before you eat or before, whatever. And then at the end of the day, you have to wipe down your equipment. That's what you have to do. Okay, so here, before I start coughing and everybody jumps off the webinar. If I give people a job hazard analysis and I give them, this is what you have to do, and then I go and check and you are not doing it, and I don't punish you, right? I don't say, oh no, if you don't do this, you're gonna get time off, or or whatever. If I don't correct that behavior that is wrong, then even if you were a minimal risk and I have taken all the precautions, but I know that you didn't take the precautions that you were supposed to, that could make it the case work-related. But that is why you've got your policies, you've got your procedures, you've got your work scenarios, because you have considered what are the possible hazards and you have protected against it. So first, the case has to be confirmed. 2, the case has to be work-related. Recognize that people can get COVID based on their social interactions outside of work, right? I can go to a party, I can go to a bar, I can go to large gatherings. That is not necessarily work-related. And so they need to prove that the case is work-related. And then finally, the case has to involve one or more of the general recording criteria for your OSHA log. So I think his name is Chris Cuomo, Governor Cuomo's brother. He works on CNN, and Governor Cuomo is the governor of New York State. His brother was diagnosed as being positive for COVID-19. So case number 1. I don't know if it was work-related, but let's just pretend that it was. Okay, so he was interviewing people before we started the social distancing, and he happened to interview all of the the people that tested positive in Congress, right? And so now we've got cases confirmed, cases work-related. However, if you've been watching him, he has been on the air every day. He has not missed any work. Because of where we are, everybody's working from home, and he has been able to work from home. And so there is nothing on the OSHA log with regard to work lost or alternate work conditions or, so there's nothing that has impacted his job or his ability to do his particular job. He wasn't reassigned or anything, right? And so he does not meet the third criteria. So would that be a recordable illness for him? In that case, no. Okay, so it has to meet all three of the criteria. For those people that are joining after or, are seeing the video, I did want to provide a couple resources for you. One was discontinuation of home isolation for persons with COVID-19. So as you think about how you are bringing people back into the workplace, here's a great CDC reference for you. Another is about how to clean and disinfect your facility and some guidance around that. And then guidance on cloth face coverings to slow the COVID-19, as well as some do-it-yourself examples of how to make face coverings. And then finally, kind of just to close this off, just to share with you, hopefully you can glean from this what you need to do. And I've given you some references, and those references also have links to other parts. Like I said, I would consider looking at the bloodborne pathogen to help you with your policy decisions and doing your job hazard analysis, which you should be doing anyway. But if you do need additional assistance, we do write policies and procedures for companies, and certainly are willing to help you, give you some suggestions if that is something that you still want to do on your own. We also do provide respiratory fit testing, safety training, as well as environmental health and safety auditing. I did not give you my email, which I'll give you to you now, but I did provide the company email, which is info@cosmostechnologiesinc.com, only because that email is viewed by a lot of different people. So we can quickly answer questions in that manner. My email just happens to be hdouglas@Cosmos Technologies, Inc. So I guess at that point, I will open it up to any questions that you may have.
Thanks, Holly. That was a very informative presentation. We do have several questions, so I want to get to everybody in a time-efficient manner. So our first question is from Tina Daniels. She's asking, what if a company with a safety plan utilizes subcontractors? Will companies have to perform periodic symptom checks like taking temperatures?
So that depends on what your policies and procedures are going to be. But if you have subcontractors, you absolutely must look at their safety policies and procedures, and they must be at a minimum as strict as your own, right? Because you don't want to allow people that are not as safe as you're requiring to be around your people. So you absolutely must look at their safety policies and procedures and make sure that they are in line with your own. And then it really depends on what type of contact they're coming into with your employees as to what further level of protection you want to provide.
Thank you, Holly. Our next question is from Sarah Eve Rivera. As a tattoo shop, we are in a very close contact with clients. It seems hard to think of how to keep everyone safe with we are in such close contact. With both wearing masks, there is still significant risk. Any advice with such close contact? We are looking to reduce clients per day, as well as larger gaps between clients.
Yeah, and you want to look at gloves and you want to look at face masks, particularly for what you are dealing with. And I do believe that, you have bloodborne pathogen concerns anyway, is you look at that particular procedure and bulk it up a little bit. But certainly look at your bloodborne pathogen control plan, as a guide. But at a very minimum, I would do the face shields and gloves, and the other things that you suggested.
Thank you, Holly. Our next question comes from Kim Williams. Her question is, so as employees are trying to get hold of PPE equipment, how can or where should we obtain bulk PPE gear due to websites offering the gear but only selling medical providers or hospitals? So where do you suggest we get the gear from?
So are you talking about respiratory protection, or are you talking about face masks? Because there is the difference, right? And so with the face masks, you can make them yourself, right? So there's like a slew of ways you can make them out of socks or whatever. If you are trying to get respirators, recognize that they're giving priority to medical providers. For those folks that, went through the OSHA class, there's a number of different safety provider recommendations that we had given. I can certainly share that with Juan again, that offer bulk, given, small businesses, specifically for small businesses. So I can share that link after.
Okay. I guess Kim was asking specifically about the face masks and the disinfectants.
So where can you get them? I know some different vendors that offer bulk supplies. Some folks, even on this call, had, called me and told me about different places that they're getting it from. But I gave you some examples of how you can make it yourself. I mean, other than that, maybe making it in bulk yourself, getting the rubbing alcohol or getting the bleach and mixing it. I don't know it.
So we have a piggyback off that question from Chanel Givner. She asked, in addition to Kim's question, is there any place we can buy bulk purchases of wipes and sprays? My employees are outdoors in the field all day.
Yeah. Again, I've got a couple resources that have reached out to me, that they sell in bulk. I can share that information with you, but I don't have anyone that says, oh, this is where we get it and this is really cheap. I'm doing Amazon and stuff like that for my folks too.
Okay, thank you, Holly. Our next question is from Lucille Plummer. She's asking, how fast should the employee create an immediate COVID-19 policy and procedure plan to insert into our OSHA manuals? Or can we make this a one-page reference guide for the workplace?
Yes, you can make it a one-page reference guide. Yeah, you just need to have some sort of policy that lets your employees know what the expectation is, what the requirements are, and when you're going to revisit to make sure that it is, that you're handling it appropriately and that it's working, right? So, of all of those things, you want to be able to look and say, oh, we really didn't consider this, at some recent frequency. This isn't going to be a year-end thing. I think that this is something that you're looking at from month to month because things are going to constantly be changing. But you definitely, as you are bringing people back into work, or if you already have people, thank God, still working, you need to have done that yesterday, but it's certainly as soon as possible.
Okay, thank you. And I think we've answered these questions, but I just want to make sure I shout out the people that asked these questions. So Brian Welsh was asked in the same place. Well, the same thing about, most stores are sold out of the PPE products online. I think we gave what recommendations we had locally and as far as the links. With Aaron Hughes, we did post the links in the chat so you can find that information there. Kim had another question in terms of, basically, how can you prove if you contracted COVID-19 at the workplace or outside of the workplace?
So So really the onus for an employee is to prove that they got it in the workplace. And so for you as the owner, you need to say that you need to evaluate your workspace and say, okay, they're saying that COVID comes through contact within 6 foot. So what did I do to protect my workers from contact within 6 foot, right? You know, if it's just the workers in the workplace and nobody else is sick but that person, you know, and they're saying that it was because of close contact, probably not if you did not provide for social distance. I mean, they probably have a case if you're not social distancing, since not everybody is symptomatic. But then the other is, you know, contact. And so are you minimizing common surface contact? So really you need to look at what is it that I'm doing to keep that distance and what am I doing to minimize that contact? You know, if you are doing something to protect people in those scenarios, it may be very difficult for them to prove that they actually got it at work and not someplace else.
Okay, thank you, Holly. I believe that completes the questions that we received in the chat. We do want to make note that this recording of this Zoom conference call will be up and running on our website soon. Those links are in the chat as well, and we'll get that information out to you. We do want to make sure to remind you tomorrow at 10 a.m. we have another RCI Boost Your Business webinar series, preparing now for the reopening of the PPP. That's the SBA Paycheck Protection Program. If you have any additional questions, please feel free to reach out to us. We will do our best to get back to you as soon as possible. Is there anything you would like to close out with, Holly?
No. You know, certainly I want to, you know, to offer that, you know, if you have any questions, you know, please feel free to reach out to the email address. You know, we're all in this together. We're all learning through this together. And so we certainly don't want to, you know, we just want to share information. So please use me as a reference or a resource. I'm absolutely okay with that.
Thank you, Holly. Your presentation was very informative. We want to make sure everybody stays safe and stays healthy. Please, I can't reiterate more than one time, reach out to us if you have any additional questions, and we look forward to seeing you tomorrow on the call as well. Take care.
Thank you. Thanks for doing this.
Thank you.
See ya.
Take care.